Hello, my name is Michael Wade. I'm a professor of kinesiology at the University of Minnesota in the United States and the co-author with my late friend and colleague David Sugden of this book, which is Movement Difficulties in Developmental Disorders. And it's a practical guideline for people who are involved in delivering therapeutic services and helping children with developmental disabilities across a wide spectrum of diagnoses. And we think that this book moves beyond a kind of a theoretical approach to understanding this range of special needs and tries to, where possible, use evidence-based information to engage in therapeutic interventions both for therapists and teachers of special needs children. And we hope that people will find it valuable and useful. So I think one of the real challenges in developing guidelines for treating children, irrespective of what their diagnosis is, that they are broadly special needs children, is to try and cover the gap between the research gap between what the research tells us and what is useful to translate into clinical interventions. And in this book, we've tried to do a brief introduction and to remind readers of some of the principles that guide the research that sits behind understanding better coordination and control of, which is essentially the motor behavior of these children, and to see how those elements of the research literature can at least inform clinicians to engage in helping children literally on the front lines. I think what we've done in here, and David really made a contribution here, is to illustrate this with case studies. So in the book, there are case studies of children with these different diagnoses: CP, developmental coordination, children on the autistic spectrum disorder, children with visual problems, children with apraxia, with dyslexia, with language difficulties, and to try and understand the kinds of programs that one would develop that would relate not just to their motor deficits, but to their overall development of trying to improve their daily lives. To, for a moment, dwell on what has turned out to be something of a theoretical disagreement. I think one of the things that certainly I and David both think is an important feature is to understand more clearly how the children's perception and their relationship to their action potentials relate to why they seem to have problems with their motor behavior. Because irrespective of whether the motor deficits are primary, which is not unusual for children with CP, and certainly for those children now diagnosed as developmental coordination disorder. And the word coordination is, in fact, relates directly to their motor problems. But the secondary issues of attention deficit disorder, with apraxia, with autism, all of these kids have, in one way or another, problems with their motor behavior, whether they're activities of daily living or whether it's their engagement in a range of sport and recreation skills. And one of the things that we've tried to introduce here is that it's not necessarily a neurological deficit. Now, for CP, we know for a fact that there are neurological problems. But with developmental coordination disorder, DSM still adheres to the notion of no known neurological deficits. So if it's not a problem from a neurological perspective, one could argue that it may be a relationship between how they perceive the opportunities for action and their action potential, which is basically their own ability to respond to the activities that their perception seems to suggest. So the book that we've just published, The Movement Difficulties in Developmental Disorders, really stems from an earlier book that we wrote on typical and atypical motor development, which really looked at the research literature that relates both to typical development and how children grow and develop coordination and control and all of the different motor skills that are part and parcel of their everyday lives. And then we use some of that earlier work done for typical development to try and take a look at how motor skills and motor behavior shows up in children with special needs. And the latter half of this book looks both at children with developmental and intellectual disabilities, on the autistic spectrum disorder, developmental coordination, and other disabilities, which could be language, which could be apraxia, which could be dyslexia, where all of these kids, whether they have a primary connection with motor behavior, such as, for example, children with CP and children with developmental coordination, or all of the other disabilities which have a secondary relationship with their motor deficits. So we tried to cover the spectrum of both primary and secondary causes of motor deficits.